Today we're going to be diving into a question that might make some people cringe a little bit. So the doctor has told you that you need an extraction. Your question to me may be, why do I even need to have this tooth taken out? Yes, I get it if it hurts, but there are other indications where the tooth may need to be extracted. So let's go and jump in. All right, so you probably clicked on this video because you've been told recently that you have to have a tooth removed. Sitting in the dentist chair and him giving you all this information in real time can sometimes feel a little overwhelming just because you wouldn't expect to get that. Sometimes you kind of know that it's that bad, but sometimes you're not really sure if that's the route that you need to take. Don't panic. I'm here for you, man. We're going to answer this question, and hopefully it's going to help you with your decision going forward. There is actually a few common reasons why you may need to have a tooth extracted. One of the first reasons is you have severe tooth decay. All right, let me come in a little bit closer. Okay, so you have tooth decay. The tooth is been decayed for some time now. You got a big hole in it. You know it. When you rub your tongue over it, you know it's there. It hurts you sometimes, in the beginning, it was really hurting. Now it doesn't hurt anymore. So one of the things you got to think about, if the decay reaches an advanced stage, it can cause serious damage to that particular tooth. In such cases, your dentist might recommend extracting that tooth to prevent further complications. What complications are you talking about? We're talking about bone loss of other teeth. So teeth are neighbors, they sit really close to one another. So if you have a tooth that's heavily decayed, it's highly likely that infection can communicate with the tooth next to it. And so those are things to kind of consider when you're thinking about these teeth that are severely decayed. Next, wisdom teeth. Typically, these are the last teeth to erupt in your mouth. And so because they're late bloomers, sometimes they can kind of come in a little funny and cause quite a ruckus when it comes to the teeth that's already there. Sometimes you can have teeth that are laying on their side. Sometimes they can be reversed. And so because of how they come in, and especially if there's not enough space in the place where it's emerging from, those wisdom teeth can hurt really, really bad. And you don't need anybody to tell you that they need to come out because they've hurt so much. And so you may hear the doctor saying, well, now you got a cavity on the tooth in front of it, so we got to take that one too. And so that's not uncommon for you to hear that, but it's important for you to know that going in, and that's why you clicked on this video. Wisdom teeth can definitely be a tricky thing to go after and get. If your general dentist is looking to take these teeth out, most of the time general doctors are able to do that, but in some cases when they're laying on their sides or kind of flipped upside down, sometimes it may be best to seek out an oral surgeon to actually take those teeth out. All right, gum disease. You may have teeth that are so mobile and wiggly that these teeth could probably fall out on their own. And so when gum disease progresses to an advanced stage, that bone that encapsulates that particular tooth, it can just resorb so much to where the tooth is so mobile, it doesn't work, and it just weakens the supporting structures around those teeth. In severe cases, those extractions of those teeth are prominent. You have to really kind of get a general sense of how much bone loss you have. Typically, we see anything between 0 and 3 millimeters. That's usually considered healthy. But when you get to the 5, 6, and 7, and sometimes 10 and 12, depending on what type of probe you have, you can really see that bone resorb very, very quickly. Why does it resorb so quickly? I'm just gonna go and throw this out here for free, because you're not able to clean underneath that tissue there. So because of that, calculus and that plaque sits on the teeth below the gum line, and it just kind of makes the bone just to run away from that. Over a progression of time, it just continues to run until there's no bone wrapped around these teeth, and it becomes very hard to manage and clean, and you end up having lots of gum issues. You end up having more bone loss, and it also affects other surrounding teeth. And even sometimes when you bring your teeth together, sometimes that can cause a little bit of pain too, because sometimes that can lead to an abscess too as well. All right, orthodontic treatment. So if you're looking to get braces or improve your smile and you're on a quest to do that, you really have to, consider that sometimes in order to make space in your jaw, those teeth have to be removed. And extraction is a big part of orthodontics, so that the orthodontist creates space so that you can have proper alignment of your teeth. It's always about, keeping your smile beautiful and straight, but those are extreme cases in which you will have to have a tooth extracted. And so don't be surprised if you go to get in braces and they're like, well, we got to take some teeth out. The last thing will be trauma, injury, or infection. I get it. Accidents do happen, and in severe cases, extraction might be the only culprit, the only thing that you can do as far as that course of action to get you out of pain. This is usually done to prevent infection and to alleviate pain and to ensure the overall health of your mouth. Like I said earlier, teeth are close together, and because they're so close together and interproximal, that sometimes one can affect the other. And so if you have trauma with a particular tooth, the dentist may choose to take that tooth out. So it's not uncommon that you have to do that. Hopefully, this has helped you to see why you would have to have some teeth extracted. So that way you're more comfortable in knowing that you have the confidence like, okay, I know this. KentheDentist said this, and it's not new to me. I think that's one of the things that is really challenging when you deal with your mouth. Some of these things that are in your mouth, you'll go to the dentist and you're like, man, I'm fine. It's nothing bothering me. But the dentist will share with you that you have a cavity or you have this or you have that. And so it's always really good to be proactive. But that's one of the scary things about dentistry. And that's why it's important for you to find a really, really good dental provider. They won't steer you wrong. At least I hope so. I'm going to place some links below for you to find good dentists, good board certified dentists. I don't know any of these providers, but you can definitely look at reviews. That's always a good place to go. Word of mouth is always good too as well. And then if anything, just trial and error. You go in, if you like the vibe, good. If you don't, move around, and hopefully you find the right doctor that fits and works for you and your family. I always got to say this every single time, man. This is YouTube. You cannot just go off of what I say. I'm giving you general information, but it's very important for you to seek out care with your doctor, with your dentist, so that they can see a specific plan for you. That's all I got. You guys be blessed. Talk to you real soon.